to introduce our next speaker, Jane Sarasohn-Kahn. She's a repeat presenter at the Social Media Center, and today she's going to be covering some aspects of mobile health. And on that note, one of the things that we're doing here is, of course, during the Q&A session, taking questions from the audience. But for those of you out there on Twitter who are following this, we're going to take questions using the hashtags #HIMSS11 combined with mHealth, since that is directly related to this. So if you use both of those, you can send in your questions, or if you follow both of those together as a search, you can see what's happening and some of the commentary from the audience. So we'll make an announcement on this via the main Twitter account, but if you're following this, that'll be a great way to see sort of how the audience is interacting with Jane. So without much further ado, Jane, please join us on the stage. Thanks.
Thank you. Thank you. I'm so excited to be here. 2 years ago, when there was the first Social Media Center, it was this little postage stamp of a space, no space. We were standing room only because people were already tweeting back then, and it was hot and we were sort of marginalized. Last year we had bloggers panels in a lovely room. This year we've got the loveliest piece of real estate at all of HIMSS. It's very exciting with really good bouncy carpeting. So I see that our value in social media and health is really rising as appropriate, I think. So I'm going to talk about social aspects of mobile health and start out and say that if you've been following the conference circuit in the last 6 months, there have been at least 40 conferences that had mobile health tracks on them. Here in Barcelona, in Japan, in Dubai. So mHealth has been good for the conference business, but I don't particularly think it is a holy grail for health, and I'm going to tell you why. I think there are opportunities and barriers, and that's what I'm going to talk about. Just so you know who I am, I'm a health economist by training. So I think about how resources come into the system, how they get used, and with a firm focus on outcomes and evidence. That's really how I look at the world. So let's go. People are project managing their lives in many ways, especially online. These are some of the sites that I use to project manage my life. All the women in the audience, if you buy from Zappos, raise your hand. Hello, we love our Zappos. And I talked to Chuck Schwab for my investments. Anyway, people use lots and lots of online networks and social, and this chart changes by the week, more and more. And the shocking thing that I learned, and I watch this space constantly, is that last year, Facebook gained 8 new registrations per second. Per second. I was even shocked by that, and this stuff usually doesn't surprise me. So we DIY life, and we're DIYing our health. And I have to say, I don't think the questioner from the last session is in here asking how will meaningful use impact the patient, but patients and people are already ahead of institutions, providers, pharmaceutical companies, etc. And these are just a few of the places where people go to project manage health. I use the Mayo Clinic meditation app on the left on my iPhone because I'm a longtime meditator and I don't have to carry a candle and a match into a hotel room anymore. I use that. I have my Fitbit on, you can't see it, it's under my dress, and I use a lot of these other sources as well. Something important, we hear a lot about privacy, and people don't want to share their health information. Well, let me tell you, PricewaterhouseCoopers learned a year ago by a survey that 4 in 10 Americans said, within a couple of years, I am willing to look at my personal health information via my mobile phone. So you have to ask yourselves the question, privacy, where and for whom? If I trust a portal, I am sharing my information. As Deborah pointed out, Patients Like Me has been collecting and being a good steward of personal health information, really detailed, intimate personal health information for several years now. So it's all about trust and authenticity when people are working online with stewards of their health data. So on the opportunistic side, mobile is the new wellness delivery channel. I didn't make that up. That's a quote from John Madison, the Chief Medical Information Officer of Kaiser Permanente, who said this: mobile, the new wellness delivery channel. He's a pretty smart guy. You got to respect what Kaiser does in health IT. If you look at the lower right corner, here's a quote from a guy who's going to be on my South by Southwest panel in Austin in a few weeks, BJ Fogg, the founder of the Stanford Persuasive Technology Lab. BJ studies how do we use computers and mobile to nudge us to do the right thing for our health. So BJ wrote in the book Texting for Health a couple years ago, we not only adopt cell phones, we marry them. A few years ago, before I had an iPhone, my husband carried a BlackBerry, brought it to bed once in a while to do a little email at night. I said, get rid of that thing. 2 years ago, I got my iPhone. Guess who's bringing her iPhone into that inner sanctum? More information than you want to know. We marry our cell phones. We don't just adopt them. They are beloved to us. And I think you could see that why even in the post-recession environment where people's housing values fell and we all began to shop at Walmart or Target or name your favorite discounter, we still spent a lot of money on fancy mobile phones, increasingly smart mobile phones. This year, smartphone sales will beat PC sales, and by the end of 2011, the fourth quarter, there will be more smartphones on the streets of America than fully functioning phones. And the prices of these phones and the network charges are coming down. Moore's Law impacting mobile. So we learned from Susanna Fox, who's at Pew Internet and American Life Project. Just fair disclosure, she's also a friend of mine, so I love using her data. She shows us through her data over the last few years that the more digitally mature we get, meaning the more we go online and the more we use online sources, the more we're engaging with social media. And in health, that's a powerful thing. Last week, the important report came out from KPCB by Mary Meeker and Matt Murphy on the top 10 internet trends. A lot of you've probably downloaded it. If you haven't, go see it, kpcb.com. That's Kleiner Perkins Caulfield Byers, the VC firm in Silicon Valley. And in that report, Matt and Mary call out mobile health for monitoring, diagnosis and wellness. Watch for this space to be hot. Of all the things they can talk about in that report, online banking, mobile social, they call out online and mobile health. So pay attention, this is real. That same firm has a guy in it named John Doerr, D-O-E-R-R, who coined this six-letter phrase, SOLOMO, social, local, mobile. That's what the mobile phone gets you. And in health, that's a powerful thing. Those three little syllables, social, local, mobile. I'm putting on my health economist hat now. One thing that moves markets, that enables markets, is the movement of good information where it needs to go to people who make decisions here about health. This is an ad from my favorite grocery store named Wegmans. Maybe you have them in your neighborhood now. Since I live on the East Coast, I'm lucky enough to have them. And this ad shows what a lot of discount and pharmacy chains have done, discounting generics to $4 for 30 days, $10 for 90 days. This is a good piece of information if you've got someone who's in that donut hole in Medicare in your life, because they now know they can go to this chain and buy cheap generic drugs that are good quality. I say cheap meaning cheap price, not cheap quality. But what I'm trying to raise here is that when that information comes to you via a mobile phone at just that point of purchase, it enables a market to happen. A smarter consumer who can make a smart decision at that point where they're making a decision. Just think about that kind of information for quality of health plans, quality of doctors on Yelp. Hate that doctor. Did my pap smear and it was really painful, girls. For the guys, prostate exam, I don't need to say anymore. In any case, when that information is social, local, and mobile, it's in your hand. You make good choices about healthcare depending on the quality of the data. Got to use sources that you trust and that you respect and that are authentic to you. So this is a bottom line for Susanna Fox's mobile report last year. She says, once you have a wireless device as a health citizen, you are more likely to use the internet to gather information, share information, and create content. That meaning social, blogging, wikis, name your favorite content place. And in healthcare, this is really, really important, the social aspect of mobile. So we have to say, once you have a mobile phone, it enables you to be social much more easily than even on a desktop, because it's immediate and visceral. Now, from a survey just from November, a different kind of firm looking at mobile health, Euro RSCG, which is a big PR and advertising agency, they surveyed American adults and found that about 4 in 10 said, with my smartphone, these are smartphone users, I will use that phone for more mobile health apps to access health data. Now that's a pretty much of a tipping point to me. That's almost 1 in 2 health citizens with smartphones saying, I'm going to use that phone for health applications. And I don't just mean health apps, I mean other things besides, say, keeping my calories, but really doing some interesting things like keeping me on my medication adherence program, like the smart pill bottle that Deborah talked about, Vital Caps, which is Vitality Glow Caps, sorry, which is a great invention. Now, lest you think I'm all about happy, and M-Health, let's talk about some of the barriers to full engagement in health via mobile phone, because there are barriers, and one of them has to do with demographics. Clearly, older people, look at the 65 plus column on the right, do things on mobile and social less than younger people. While that's intuitive, you got to keep that in mind, because in health, the older we get, the more chronic conditions we have, and it's much more difficult to manage them in real time, and on mobile it's a particular challenge when people don't have that platform. However, older people are buying new phones, replacing old phones, and those phones are getting smarter and smarter. So what I'm saying is there is an adoption curve of mobile and social in health that will vary by demographics, not just age, but by ethnicity. One of the fascinating things we've learned from some of Susanna Fox's data, I'll go back in a second to the other chart, is that blacks and Hispanics use health apps more than white people do. And there are some interesting hypotheses around that, like maybe white people tend to have a medical home more than people of color, which is something we have to start wrestling with, health disparities in health services, and how can we use these technologies to even the gap in health disparities, something I think about a lot. So let me go back from Susanna Fox's data. Another issue is that people with more chronic conditions tend to go online less than people who are healthy. That's counterintuitive, but it has to do with people who might be disabled, lack of access to broadband and fast connections, etc. That's why when you think about the FCC report on broadband that came out about 18 months ago, there's a huge chapter on healthcare, and the importance of broadband in health is really important. Because once you have broadband and not a slow connection, you tend to stay online longer. And when you stay online longer, you can learn more about your health condition and gain health literacy. And health literacy breeds health engagement, and health engagement breeds better outcomes. So broadband is important to keep in mind when you're thinking about health and access. However, even though I say people with more chronic conditions use online health data less, it's still a pretty big number. 52% of people with 2 or more chronic conditions are going online for health information. So this is a hopeful sign. We just have a few extra miles to go before we sleep. Now, another aspect of a health barrier is health engagement, or lack of health engagement. And I just love this cartoon, the New American Idol, I-D-L-E. Health engagement's really important. One of my clients is Edelman, the big PR company, for whom I inform their health engagement barometer, which is a survey of health citizens around the world in 12 countries to figure out who's engaged and who's not. And it's a market segmentation exercise. And we learned that in any country around the world, between 20 and 40% of health citizens are not engaged. We can call them couch potatoes, we can call them health disengaged, call them what you will. What I call them are people who we need to re-engage and get more involved in their health, because a lot of these people, say, are diabetic, have complicated treatment regimens, and we need to get those people engaged so we, 1, have better health outcomes individually, 2, collectively have better public health, and for somebody like me, a health economist, we bend that cost curve when we engage people in health and improve outcomes. Now, another barrier is physician willingness to engage with patients who are uber engaged. Where are the physicians in all of this? Well, today a few will health engage with patients who are connected through phones, but not a heck of a lot, no tipping point there yet. However, looking at the future to new payment models, and Deborah alluded to this earlier, when we start to think about a patient-centered medical home, accountable care, and bundled payments, all of a sudden if a doctor has discharged a patient with congestive heart failure home, that hospital from which that patient was discharged may not get paid if that patient is readmitted under health reform laws. It's in the fine print, but it's important. And so once payment is bundled, you have an incentive to innovate Imagine that, working under a budget. So all of a sudden, I can imagine in a few years, we will be prescribing health providers a patient to go home with a MedEps heart monitor. That's a USB port into a computer that can transport that piece of data on heart rate, or a Wi-Fi scale like I have called the Withing scale that automatically takes my weight and posts it in my Fitbit website where I can keep my weight ongoing. Not that it's always a good news thing to do, but I'm trying to know my numbers better and become a more quantified self. Anyway, a hugging permitted. We'd love physicians to more engage with patients in participatory health. Again, what Deborah talked about. So a quick snapshot on social mobile health. As I said earlier, consumers are way ahead of health providers, clinicians, and hospitals. Clinicians, about 60% are using Sermo and other professional networking capabilities, but that's for doctor to doctor, not doctor to patients. There are sites, however, like MedHelp, the big social networking site that's very mature, over 10 years old. And MedHelp sees physicians from Johns Hopkins and elsewhere convene with patients online to give to answer questions. It's not so much giving advice, but they respond to questions. So we are seeing a group of physicians engaging online with patients. For institutions, the guy to follow here is Ed Bennett. You can follow him on Twitter, and he keeps track of every hospital who's doing something in social networking with social media online. He says over 700 U.S. hospitals now are doing something with social media online. And you can look to CDC, your tax dollars at work, who are doing a lot of work with social networking online. Now, a couple other data points before I sum up here. It's early days amongst health leaders for engaging in social media and health. This was a survey in health leaders from October. Health leaders, to them, are people in leadership, finance, executive positions. And very few of them are taking a % of their marketing budget and putting it into social media. However, a good third say, I believe if I invest in social media in my marketing program, it will be effective. So they're positively predisposed to doing this, and I have a feeling they have to figure out what's the ROI in the business case to my leadership for doing this. So we are primed for this in institutions, and Ed Bennett would be a good person to talk to about this as well. I just want to give you a few examples of where we're seeing social and mobile in health right now. As I told you, I'm wearing a Fitbit right now under my dress. There's another device called a DigiFit that does the same kinds of things. Calories consumed, steps and exercise, sleep habits, and here the DigiFit is marrying to the Withing scale, like I have the Wi-Fi scale, and Facebook, where if you choose to do so, you may share your personal wellness information and fitness information with colleagues. Now think about the power of Weight Watchers. I'm talking old, offline social networking, when you used to go there in the 60s and 70s and weigh in and tell your story to a group. This is the new Weight Watchers online sharing, and this works really well when you're reinforcing the support in an online kind of an environment. There's a lot of data on this now. So this is one example. Another example that sounds cute, but it's pretty powerful, is called Tweet What You Eat. Alex Ressi, I don't know, Deborah showed data from Manhattan Research, and one of the heads of research there is named Meredith Abreu Ressi. When she was getting ready to marry Alex Ressi, when she was still Meredith Abreu, Alex wanted to lose 15 pounds before he married, and he innovated Tweet What You Eat. It is a way you're out and about, you're at name your favorite fast food place or pizza joint. You take a picture of what you ate, you put it on Twitter, and you ask your friends on Twitter, how many calories do you think this is? You crowdsource the calories, and you record what you eat. You tweet what you eat. And by the way, this worked for him, and he did lose weight before his wedding. And he didn't really need to lose a whole lot, by the way. This is another one of my favorite social networking mobile applications, Text for Baby. It's a year old. The baby is a year old. This was launched last year, a public-private partnership, and what's very important about this is it gets a mobile health application to women who are in their prenatal care term, and it forces good habits for prenatal care. Seeing the doctor, taking prenatal vitamins, all of that. And the beautiful thing about this is it's a public-private partnership where private telecommunications companies, many of whom are here on the floor, are providing the text messaging services for free for this application. And also it's in Spanish and English, which is, I have to say, is a beautiful thing. The MedHelp Mood Tracker, I mentioned MedHelp earlier. They are not a client of mine. I just like what they do. This is one of several apps they've developed for iPhone, and they have Android in development, I believe. The Mood Tracker helps you, yes, track your mood, and it has a social component where, again, you can get support from people online if you're feeling particularly blue at that point. So I've told you about some opportunities for social in health, mHealth. I've told you about some barriers in social for mHealth. The one I want to just draw your attention to one more time is in red print. Look for new payment models in healthcare to start aligning incentives for patients and providers and payers to come together to innovate so that we are now adopting mobile apps 24/7. The patient is only with the doctor a couple minutes a year, but if you're a diabetic, if you have asthma, name your favorite chronic condition or your least favorite chronic condition, you're largely managing that at home, in your community, at school, at work. You need 24/7 help, and that's the power of mobile. When payment comes together for innovation in the form of bundling, so that a doctor and a provider are accountable. There's a reason the word accountable is being bandied about. When you are accountable for care, it concentrates the mind and it drives innovation. Ted Eaton is someone you may know. He's not at HIMSS this year. He had to spend time out at Kaiser in California this week, but he is an evangelist physician for online and mobile health, and Ted says something very important. He says it's not about the tool. I'm not saying mobile apps is the holy grail. I've told you that this whole talk. It is a tool, and the tools will change. The point is, how does the tool help people change health behaviors? That's what we're all about. Engage the patient, engage the doctor, change the behaviors for good. So I am all about connected healthcare, information therapy, send the patient to the right website, the credible website, put it in a social network when it's appropriate, connect the health, change the health behavior. And in that theme of connected health, I'm very excited today. In the last 30 minutes, my new white paper was launched on the California Healthcare Foundation website called The Connected Patient, and it's all about remote health monitoring, again, opportunities and barriers. It was just put online, and I'm taking advantage of this and all the Twitter community to get it out there. It is free, chcf.org, and it's actually also on Twitter. We put a note up just before I started. If you want to talk to me, I'm at Healthy Thinker on Twitter. My blog is healthpopuli, healthpopuli.com. I write every